All right. Hi, everyone. Thanks for joining us tonight. We'll give you all a minute or two to get on in, get settled, make sure your Zoom's working before we get started. Um,
Hey
as I'm
everyone.
sure. Oh, go ahead, Rebecca.
No, just saying hi.
Make sure to, before we get started, familiarize yourself with Zoom. We will have the chat function available too. Um, and we'll kind of go over logistics in a second, but we'll give you all another minute before we dive right on in. Okay. All right. I think we're good. I think most people have jumped on in. Why don't we dive right in? So, first off, thank you all for joining us tonight for this Elite Medical Prep webinar on USMLE Step 1. We're going to start off with some introductions about who we are, not only as a company, but who Rebecca and I are individually. We'll go a little bit into kind of the outline of tonight, what we hope to convey to you, and then we definitely want to leave some time at the end, really for questions, whether that's through the chat, whether that's turning on your microphone. We want this to be interactive and be tailored to you all, and to answer any questions that you have. So the chat function is open right now. When I'm speaking, Rebecca will monitor it. When she's speaking, vice versa. So even if you have a question that pops up in the middle of the presentation, we really want you to ask them then. Don't feel like you have to save them for the end. Okay. So we'll start off. I'll have Rebecca, why don't you introduce yourself and then I'll follow?
Sure, thank you. Hi everyone. Happy you're all able to join. My name's Rebecca. I've been with Elite Medical Prep for about a year and a half now, and I did my medical school training at University of Vermont. Here in Florida now for my intern year training. I'll be going to University of Miami here very shortly for my dermatology residency. So that's just a little bit about me, but thanks for joining.
Great. And my name is Dylan Eiger. I did my an MD PhD down in North Carolina at Duke University. Then I went up to Boston to the Brigham at Harvard Medical School and did my internal medicine residency there. And now I'm back in Philadelphia, where I grew up at University of Pennsylvania for cardiology fellowship. I've been with Elite Medical Prep. I think this is like my seventh year, so I feel very old, but I'm still loving it. So it's been a lot of fun. Um, so to give you all a little bit of background about who we are, so Elite Medical Prep, we're really a tutoring organization where we help students of all different levels of their medical school training, all different backgrounds, help them through medical school residency, even fellowship, even people in undergraduate education. But in addition to our individual tutoring, we have a lot of partnerships with medical schools around the world, some of which are listed there. And as I kind of mentioned, we really dip our toes into any part of the journey into becoming a physician. So that's all the way from starting with the MCAT, even pre-MCAT coursework in college, all the way up to licensing exams. So whether it's internal medicine, dermatology, cardiology boards, we kind of cover the whole spectrum. We provide really individualized tutoring and we tailor it to you. And that's why, as I kind of mentioned already, please be engaged tonight. Bombard us with questions. We want this to be interactive. And we'll have some polls that pop up along the way that we hope you'll participate in, just so we get an idea of where the group is at. Um, so really quickly, in terms of what we hope to cover tonight, we want to do kind of a crash course of how to succeed on step one. This is going to come down to logistics of studying, how to actually answer questions, how to assess your readiness, some resources, stuff like that. So at times may feel somewhat superficial, but we're doing that simply to cover as much information as we can. So again, if you have questions about specifics, please interrupt us. So we'll kind of dive right on in. And really we want to start it off with what do you need to do to succeed on step one? And I think the first thing to define is also what does success look like? And it's a lot easier now because when I took this test a very long time ago, it was scored. And that was a score that you used heavily in the residency selection process. But now it's pass fail. And I think that's a really great thing for most students in that it alleviates the burden of studying some of the basic science and allows you to really focus on becoming proficient with the preclinical coursework. So, in order to do well on this, you really need to come in with a good plan. And I think that starts with time, making sure you give yourself enough time, knowing that even though that this is pass fail, there's a very diverse amount of time that people need based off of their level of comfort with this material. Using high yield resources, and I'll add to that, limiting the number of resources that you use. I'm sure if any of you have started studying, there's 1,000 resources available on the market. And it can often feel overwhelming that you'll work through five of them, let's say, and then you'll see that your friend or your classmate is using one that you're not using. And sometimes there's this like FOMO of, hey, they're using that resource. It seems like it's working for them. Maybe I should use that too. Know that there's multiple ways to succeed on this test, and you don't need to use every resource out there. However, a non-negotiable resource, in our opinion, are practice exams, and I think most of you would agree with that, that you have to assess yourself with an examination that simulates what you'll be doing on test day. Um, and then I think really the one of the most important things is kind of once you figure out how much time you have, what you want to use, and how you're going to assess yourself, you then have to come up with an actual roadmap, a calendar that you'll stick to. Um, Most of us, when we have studied for the MCAT, often that is during times of other stuff going on. So what I mean by that is you may be studying for the MCAT while you're in college or while you have a job or internship over the summer. This is really the first time for many of you where you'll have often have dedicated time, uninterrupted. You have like, let's say, 4 to 6 weeks to do whatever you want. And that can be overwhelming for a lot of students because they've not had that much autonomy. So it's important to come in with a game plan and know what people have done before you that has been successful. Rebecca, anything to add there?
Yeah, no, I think that covers it. And then also I just want to emphasize with the resources that it's so easy to go into resource overload. That's like a real challenge I think that students face. So, stick to your top like two or three resources. Most of the high yield resources cover, the high yield material. They may do it in a different way, have different organization, but it's really important to be mindful when you're creating that plan, like Dylan was saying, that you're not overloading yourself with material that's unrealistic to get through. So that's probably what I would say.
That's a great point. All right. So, kind of as we mentioned first off, you got to think about how much time you'll need. I think from Rebecca and I, when we were putting together these slides, on average, we see most students will get about 6 to 8 weeks for dedicated. I've seen students only get as little as 3 weeks. 4 weeks is generally kind of the lower end that I'll see, but I think 6 to 8 is an average dedicated period. I'll be transparent with you. When I started working with students on step one, when it was scored, I actually did not recommend taking the practice exam out the gate because everyone did poorly. And it was kind of like, all right, you're going to do bad, so let's just start studying. I very much have changed my approach now that the test is pass fail because you may not you may be pretty close to passing out the gate, and that will very much dictate how much time you need to study and how you study versus someone else who's does not do very well in that first test, and it probably doesn't change much in terms of your approach. You're still going to study as hard as you need to. So I'm a big proponent of getting that diagnostic test out of the way de novo when you don't have much information, much studying under your belt to establish that baseline, and then that'll help inform your next 4 to 8 weeks in terms of how you're studying. The next bullet point I think is one of the most important in that there is no specific magic formula that everyone should follow. Um, you really need to think about who you are as a test taker, what other commitments you have going on during your life, how much time you have, what are your strengths, what are your weaknesses, and make a study plan that works for you. And we'll have at the end, Rebecca's going to go over some of the mock schedules that we have that should serve as templates, not roadmaps. Um, Plan to study at least 8 to 10 hours a day, ideally 10 to 12. Now, when I was a medical student, I surveyed the students at Duke in my class, and on average, and again, take this with a grain of salt, that it was back when step one was a true scored exam. The average student was studying for about 13 and a half hours a day for about 6 weeks, with about a half day to a day off. Now, that amount has definitely scaled back now that this is a pass fail test, but I still encourage my students to aim for 10 to 12 hours a day. You should treat it like it's a full time job, to be completely honest. It's not a fun full time job, but you have to put in the time. And there's very much a correlation between those who spend more time and those who tend to do better on the test. So you want to find a way to not only use to fill that time, but to use that time effectively. So, for example, 6 hours of Anki is probably not the best way to spend your day. And we're going to talk a little bit about how to structure your day, your resources, but you should be putting in the time and effort because this exam really demands it. And start early. I've been working with some students at a medical school in Israel, and I've started meeting with them back in February. Many of them are not planning to test until August. And their medical school wanted us to advise them, kind of get an idea of where they're at now, about 6 months prior to the examination, not necessarily to start doing 10 to 12 hours a day, but simply getting them comfortable with the idea of what does an MBME style question look like? How much time does it take them to do a UWorld question or AMBOSS question? How much time does it take them to read first aid or go through a video on Boards and Beyond or some other resource? So starting early doesn't mean you need to come out the gates guns a blazing. You can come out early to establish your routine, learn what you like, learn what you don't like. So then when you really have your dedicated period, you hit the ground running and you're not kind of coming out of the starting blocks fumbling. Okay. So selecting your resources. So like Rebecca and I said, there's so many options to choose from. And really we want you to limit it to like 3 to 4, maybe 5 at max. And like we said, you have to pick the resources that are best for your learning style. We've listed kind of our big four main categories. So I've already mentioned practice tests. There are practice tests which come from the test manufacturer, the NBME, which uh, are probably the best tests to use. That being said, most question banks have their own practice tests, which are very great. They're great resources as well if you need more repetitions and need more of that practice. So I think a practice test is a non-negotiable. A question bank is also non-negotiable. We've listed UWorld and Amboss. There are many other question banks out there that exist. I would say UWorld for step one is very much the most like tried and tested. When I was a medical student, I think 1% of my med school class was using Amboss. Now that's very much changed. I think Amboss has grown into a fantastic resource. And UWorld and Amboss both have their strengths and weaknesses, but truthfully, I think either of them are fine. I think I or someone else in our company has actually written a blog comparing the two. So if you're interested in learning about the pros and cons of each, if you haven't had a chance to use them both, feel free to check that out. But definitely a question bank, I think, is non-negotiable. The next two, I think, are negotiable in terms of you need to think about, do you learn well from these resources? And the first is videos and the second is a textbook. So with videos, I think, ever since COVID happened, we've all become more comfortable with learning virtually and learning through videos. So you can see that there are a lot of video resources listed there, Boards and Beyond, Pathoma, Sketchy, etc. You should not be using all of those video resources, but we wanted you to have an idea of what are some of the highest yield, in our opinion, that you can go investigate. Many of them have free trials to get an idea if you like that type of video style. For example, I did not like Sketchy Micro. It did not work for me. It made no sense to me, but I really like Sketchy Farm and Pathoma. I have many students who would die by Sketchy Micro. They're like, this is the best resource ever. So you need to think about what works for you. And then that similarly transitions to textbooks. I know a lot of people don't like reading textbooks. I know some people who absolutely love them. So I'm one of those people who likes to read textbooks. So I loved first aid. There are also many other textbooks out there. Kaplan has textbooks. There's a series called Step Up, which has textbooks. There's so many out there, but first aid is without a doubt the gold standard. It's easy to read. It's as concise as I think you can make it. And it's very much highlights the high yield points. Now, the last bullet point I'll share on this slide before I hand it over to Rebecca to give her thoughts on these resources is you want some form of spaced repetition. And we also mentioned flashcards. So if you're going to do spaced repetition, which means seeing something over and over again, but over time, Anki is without a doubt the gold standard. Anki, for those of you who don't know, I'm sure many of you do though, it's like essentially electronic flashcards. Um, you need to figure out if you like flashcards, if you like Anki. I was not an Anki person. Like I used Anki just for anatomy, and the second someone tried to teach me pharmacology through Anki, I like died on the inside. It just didn't work for me. So you don't, Anki is so prevalent in medical school, but I want you all to feel comfortable saying this resource just does not work for me. Some people like to make their own flashcards and writing them. Truthfully, that's where the value of flashcards really comes from, is actually making the cards. Doing them definitely helps too, though. Without a doubt, though, you get that form of spaced repetition through UWorld or Amboss as well by not only doing questions time after time, but also going back to the ones you got wrong and learning from your mistakes and making sure that there is some improvement with time. I'll pause there. Rebecca, what are your thoughts about resources? Anything that you really worked for you that didn't work for you? How did you approach your studying?
Yeah, I think you covered it really well. I just want to emphasize again, like the importance of spaced repetition and how I like that you were emphasizing how it can be personalized, right? And so that's sometimes what I teach, the students that I work with one-on-one is how to make their flashcards more personalized while also balancing, you don't want to be spending hours and hours and hours trying to get through resources, every single day when you have limited study time. But what you all have probably realized by now is that material in medical school comes at you so fast that I have really strong students that I work with that say, I learn it really well. For the first time, I did really well on the exams, and they assume, they can just kind of retain that over time when they realize step one and step two come, one, maybe 2.5 years later. If you're not doing that spaced repetition over time, you just end up losing it because there's so much material to know and so much coming at you at the same time. So that's something that I really emphasize. And the students that work hard at sort of doing that spaced repetition to retain that information tend to have slightly easier, slightly less demanding dedicated study periods because they're not having to spend so much time relearning that information, rather strengthening those connections in your brain that enable you to recall that information. So that's what I think you should focus on when you're choosing your resources is what's going to help you be able to strengthen those connections and recall information so that you can apply it effectively during your exam and during your practice questions. And that's really how you're going to measure your progress throughout, I think.
Yeah, no, that's a great point. Rebecca, on that, Rosie just asked us a question. How many questions do you think we should do? And do you recommend repeating wrong questions or going for another question bank? What do you think about that?
Yeah, I think it really depends on the student. So, sometimes there are students that need a lot more content review at the beginning. And so they have to ramp up their questions later on during dedicated. And some students learn much better when they do content review that's guided by questions that they do at the beginning. So I think it's really individualized. If I had to give a ballpark, I would say I usually have my students do anywhere from 80 to maybe 150 questions a day, something like that. And I don't think that repeating the same questions over and over and over is necessarily the most useful thing. Sometimes repeating wrong questions can be helpful because you clearly didn't think about it correctly the first time. So sometimes I do advise my students to repeat their wrong questions to make sure they're actually reframing their mind and thinking about it the way the NDME wanted them to think about it. But that's sort of my recommendations. My study plans are all personalized, of course.
Yeah. No, I completely agree. I think I have some students who come out the gate being like, I want to do 100 questions a day. And I have some students who say, I want to do 40 questions a day so I can spend a lot of time to go through videos and textbooks. And then once
Mhm.
they finish the videos and textbooks, they're like, all right, now I'm going to 120 a day.
Mhm.
I think
Yeah.
both approaches are fine. It really depends on you. My rough rule, though, for most students, if not all students, is ideally you'll at least finish a question bank. like
Mm,
finish all the questions. Then doing the incorrects, repeating questions, I think becomes a little nuanced because if you go through the question bank once and then you take your practice test and you're 99% likelihood of passing and you get that
mhm,
score 3 times, yeah, go ahead. You don't have to do any more questions. Go ahead and take the test.
mhm.
But if you're like 80%, I completely agree with Rebecca. Like doing those incorrects, maybe doing some targeted questions on the systems you struggle with are worthwhile. I have rarely had a student do another question bank. It's almost always get through it once, repeat wrong questions, or redo some of the questions you struggled with, like systems you struggled with. That's a
For
great
sure.
question, Rosie.
Mm.
All right. So, Rebecca, if you don't mind, could you open the poll for this question?
Yep.
Um, so we're going to ask you this question. We want you to answer. There's no right answer, obviously, but we just want to see what you all think. And the question is, what style of studying should you start with? So A would be subject specific, meaning like you just study cardiology. B would be mixed subjects where you mix lots of things in together. And then C is both, where you do sometime it's mixed subjects, sometimes it's subject specific. So we see about half of you have chimed in already. That's great. Please answer. We'll give you about 10 or 15 more seconds. All right, we'll go 5, 4, 3, 2, 1. All right. I think I can hit end poll.
Yep.
Okay, perfect. So there's a pretty even split between subject specific and both. And I think both there again, like I said, there's no wrong answer. And Rebecca and I feel like both is what we generally recommend, where you structure your day where let's say, today is going to be my cardio day. So you spend time watching cardio videos, doing some cardio first aid, you do some cardio questions, but you never want to forget the stuff you've already learned. So you should definitely integrate in some question blocks of everything but cardio. In the beginning, when you're trying to just crank through the material and learn it, um, it is, I think doing subject specific makes a lot of sense. If you're like, hey, I want to spend 3 days getting through a lot of cardio, let's say you spend 80% of your day doing learning and questions on cardio, then 20% mixed, that's fine. But as you get closer to testing day, that percentage should flip. It should be mostly mixed, and then some subject specific based off of what you're struggling with. Okay, Rebecca, you have anything to add with that question?
Yeah, no, no, I think that's great. I want to emphasize too, you want to eventually end up practicing the way that you're going to be executing on test day. So the blocks are mixed on test day.
Mhm.
So it's good. Your brain learns very well at the beginning by chunking information together. But then, of course, you want to make sure you're doing your practice the way that you want to play on test day. That's the most important thing.
Yeah, yeah, completely agree. And then Trisha, I'm going to kind of summarize your question, but essentially you're struggling with going from passive to active recall, getting overwhelmed by the number of questions that you have from the On King deck, and your sentiments are exactly how I probably have 50% of students who do Anki feel this exact same way. They're like, Dylan, I have 600 cards that my app is telling me to do. And I'm like, just clicking through them, not really learning that much, just so you can get to questions. If it's not working for you, then stop. And you should feel comfortable stopping. I don't want you all to think that you have to do any one resource. I'd say the non-negotiables again are you definitely need a question bank, you definitely need practice tests. But everything else, it's up to you. So Trisha, if you're like, look, the cards are fine, I can get through them, but it's causing me more anxiety, I would just stop and do questions, figure out what your strengths and weaknesses are, and then be like, oh, maybe I'm really bad at rheumatology. Let me just focus on those Anki questions and know that my scores in psych and renal and palm, they're okay. So I don't need to do those flashcards, okay? Um, what we've kind of structured here is a general idea of what we think of how you should structure your day. And we really emphasize active learning first and passive learning later. So active learning is going to be at the bottom where you're doing questions and review. And then as you move up here, it becomes a little less active. Okay. So I have students who I always ask them, are you like an early bird or like a night owl? Which now that I'm thinking about that, they're both birds, but not that that's relevant at all. But um, if you are someone who works really well in the morning and you wake up, you're super alert, that's when you should be doing questions. Mostly because that's what you're going to do on test day. 8 a.m., 9 a.m., that's when the test is going to start. So we want you to start out with that active learning when you're most awake, most alert, most focused. As the day goes on, you should continue doing questions, but start layering in some of that passive learning, flashcards, videos, reading, because truthfully, those are, I think, a little bit less intellectually, less demanding than questions are. So, if you're at the gym on the treadmill and you want to do some Anki or watch a video, great. You can get some fitness in, then you can also learn, and it's not feeling like it's a slog throughout the day. So we think we put questions at the bottom because I think that's the foundation of everything. And then that should help direct how you spend your time with the passive learning. Okay. Um, so I'm going to quickly walk through a question, and I'm doing this because we're now transitioning this part of our talk where we kind of go over test taking skills. Um, when I meet with students for tutoring, the first like 4 or 5 sessions I have with them are almost entirely on test taking skills. So I'm not going to be able to cover everything that we go over, but I just want to give you a few pointers as to how I approach questions like this. So I'm going to walk you through how I approach a question. And I'm going to ask you some things along the way, and I'd love for you people to just put their thoughts in the chat as these questions come up, okay? So I recommend, and Rebecca will obviously get your thoughts at the end, but recommend reading the question stem, the last sentence down here at the bottom. So which of the following is the most likely cause of this patient's clinical deterioration? So I know the patient is going to deteriorate, and effectively, I need to just diagnose them. Like I need to tell what's going on. So it already frames my thought as to how I need to think about this patient. So then I go to the top. So a 35-year-old previously healthy man is brought to the ED after being involved in an MVC. I always like to stop there and think about what's my differential, right? So this is a 35-year-old person, trauma. Okay, well, I'm presuming that the question's not going to be that he's in like DKA because he has diabetes, right? He's previously healthy. It's probably something related to the trauma, which is very broad. But you always want to start thinking about, okay, I know this is something that's going to be a mechanical injury. That's how I should frame my next sentence. Unrestrained driver hit his chest against the steering wheel during the collision. I tell my students to stop. And now I'm going to ask you all, now that you know he was an unrestrained driver and he hit his chest against the steering wheel during the collision, what is on your differential? And if you could just put it in the chat, there's no wrong answers. Tell me what you think. What could be going on? Perfect. Aortic dissection. I really like that answer very much. A decelerating trauma of the chest could be aortic dissection. What else? And just because I'm a cardiology fellow does not necessarily mean it has to be related to the heart. Pneumothorax. Perfect. Your chest hits the steering wheel. You could easily either break a rib or not and just pop a pneumothorax. Love that. What else? Let me get one more differential. Hemothorax. Beautiful. You crush a rib, a blood vessel breaks, and you bleed into your chest. Love it. Good. So you can see how we're already thinking about what our differential could be based off of 2 sentences. We have we have age, sex, and mechanism of trauma, and we already have 3 differentials, which is great. So when the paramedics reached him, he reported chest discomfort but was hemodynamically stable. So that still could be any of these 3. Like you can have an aortic dissection and be hemodynamically stable. Pneumothorax, if it's not tension pneumo, can be hemodynamically stable. Hemothorax, depending on how early or late you are in the process of that, could also be hemodynamically stable. So I'd say these 3 are still on the table right now. Shortly after arrival at the ED, the patient experiences worsening respiratory distress and becomes hypotensive. Now my differential has changed, right? I don't think that this is an aortic dissection. Aortic dissections don't normally present with respiratory distress. So I'm going to eliminate, or not eliminate it, but lower it on my chain of where my differential is. And I'm going to keep hemothorax and hemothorax and pneumothorax because both of those can present with respiratory distress. On physical exam, the patient appears anxious and is tachycardic and tachypneic. Doesn't really change my differential, right? I still think those two are pretty reasonable. Trachea is midline and jugular veins are distended. Now this is some important information. So how does this change my differential? And if you don't know, I'm going to give you all a few seconds. If people have thoughts as to is pneumothorax or hemothorax more likely? Are there new differentials that we need to think about? Does anyone have any thoughts? And if I'll give you guys like 10 seconds. If I don't hear about anything, I'll give you my thoughts. And please, this is a safe space. Anything is okay to share. All right. Tamponade,
Tampa?
great. I think that's a great differential, right? We now have jugular veins that are distended. We need to explain that. So no pneumothorax, okay. JVD, right heart issues, tamponade, perfect. So if the right heart fails, that's going to present as jugular venous distension. No pneumothorax. So Lori, I think what you're really getting at is there's probably no tension pneumothorax, which I agree with. If you had a tension pneumothorax and we had lots of air on one side, generally that trachea shifts away from midline. So I agree with you. If it is a pneumo, it's probably not that bad, but then like, why is this guy so sick if it's not like a bad pneumothorax? So I agree with you. So great. I love how you're all changing your differential with time. Anterior chest is bruised and tender to palpation. Not surprising, it was in a car accident. Vesicular breath sounds are present bilaterally, so those are like fine crackles. So to me, that just sounds like there's probably trauma to the lung. Abdomen is soft and non-tender. Which of the following is most likely diagnosis or cause? So really, I think we've gone through all of our differentials. Oh, and Rosie, great point. If it's vesicular breath sounds, it's not a pneumothorax or hemothorax because if it was a pneumo, we'd be absent. If it was a hemo, it'd be dull or absent. But great point. So I think we've ruled out everything we initially started with, and we brought in new ones, whether it be tamponade or some form of cardiomyopathy that presents with hypotension and jugular venous distension. So we've thought through this so well. We've come up with a potential diagnosis of tamponade, and we haven't even looked at the answers. So when we look at the answers, we now have a place to start. So you guys did a fantastic job. We essentially, hemothorax and pneumothorax we've ruled out. Aortic rupture, we didn't say specifically, we say aortic dissection, and diaphragmatic rupture, but cardiac tamponade is there. So I'm going to stop here because I don't want to, I know Rebecca's going to do some teaching on a question of her own, but there's a lot of strategy into how to go through these answer choices systematically and to really narrow it down to get to the right answer. But you guys are right that this is tamponade. Other things you would want to expect is you can see distant heart sounds. You could check what's called the pulsus paradoxus. There's a lot of other physical exam findings that you could think about with tamponade. But it was great. I think this is really good that you guys saw you were able to come up with a differential and refine that differential. So by the time you got to the question step again, you already had an idea of what was going on. Okay. I'm going to pause here. I'm going to pass it over to Rebecca, and she's going to kind of do the second half of the presentation and also go through a question of her own, okay? All right.
All right. Excellent work. I had one more question I want to go through just for practice again. So please feel free to participate and put any thoughts you have in the chat. I love the way that Dylan worked through that question. I teach students to approach it in a very similar way. I like for students to read the actual question first and then the stem. So, if we're going to start with this question here, which of the following is the most likely diagnosis? So again, that kind of puts you in the right mindset for what you want to pay attention to when you read the STEM, because the STEMs can get long. They can be overwhelming, and I'm sure you guys are, or maybe not yet, but as you go through your practice questions, we'll see the HPI style questions also, where it's easy to get lost in the details. So it's nice to have a nice frame of reference before you start reading the larger STEM. So I have a 52-year-old female. I always tell students to pay attention to age and gender. That's what I call the patient demographic. That alone can help you narrow down answer choices. And this is part of test taking strategy, which I emphasize a lot. Okay. Who comes to the physician because of a raised, crusted erythematous lesion on her nose. Okay. The lesion developed, grew quickly over several weeks, now appears to be shrinking in size. So that tells me something about the timeline. And that's something else I like students to pay attention to as part of test taking strategies. You can narrow your differential a lot just by patient demographic and timeline alone. And so I always think it's important that you're cross-referencing your answer choice with both of those things to make sure, does it actually make sense, right? With the clinical context that they gave you in the question. Okay, it does bleed occasionally. Okay, the patient grew up in South Florida, had 5 blistering sunburns during her childhood. A photo of the lesion is shown. Which of the following is the most likely diagnosis? So if you were to kind of take a stab at this one, what do you think? What's on your differential here? And take a minute or a few seconds. Okay, think it over. Good. Yeah. Perfect. Maybe give it to 30 seconds and then I'll stop the poll. Good. I see some votes for basal cell carcinoma. Good. So I'll end the poll there. Yeah, really good. Um, so a lot of people had some really good thoughts here. This is a tougher question because, I know, and I'm sure as you all know, we don't get a ton of derm in med school, in the preclinical curriculum. But this is how a lot of these derm questions will present. They'll give you a photo and, they'll give you maybe a little bit of the clinical history and want you to kind of identify what's going on here. So, like I said, patient demographic, timeline, and history is really, really important, right? So, a lot of you said basal cell carcinoma, right? I agree with you. She's got so many risk factors for basal cell carcinoma, right? Lots of sun exposure, blistering sunburns, right? All these things. A little bit older, right? Patient demographic. Let me ask you, do patients usually grow basal cell carcinomas in a couple of weeks that are like this big? What do you think? I'll let you think about that. We always want to, yeah, and also actinic keratosis, right? We want to think about timeline, right? Because a lot of these skin lesions can definitely, right? They're similar risk factors, but the timeline and presentation is going to be really different, right? Basal cell carcinomas, your run-of-the-mill squamous cell carcinomas take a while to grow and become this sort of large and ulcerated, right? For the patient to notice. So the answer here is actually B, keratoacanthoma, which is actually a type of squamous cell carcinoma that develops really quickly and then involutes often on its own. And the nose is a very common place. So this is one of the most common NBME presentations of this type of skin lesion. And again, that's why I emphasize to students timeline, right? Is one of those test taking strategies is so important. Make sure that you're always cross-referencing your answer choice with timeline, as well as some of the other features that we mentioned in the question. I like the actinic keratosis too. Those are a little bit more scaly. Those are the precancerous skin lesions, right, that can often become a squamous cell carcinoma. But in this particular skin lesion, we've gone past that into the cancer diagnosis here. So questions about this one? Does that make sense?
That was really great, Rebecca. And I think it's really nice for her, for us to see her approach because you're seeing that there's so many ways to tackle a question, and you as a test taker should really accrue all of these skills and use them. And each question is going to require you to have different skills. Focus on timeline, focus on symptoms, focus on sex, gender. And that's really where it's a skill that they don't teach in medical school. but it's definitely one that's necessary for the test. And then Rosie asks, should we read all the options at the end after reading all the HPI? Rebecca, what do you think about that?
I think, what I teach students, and it's kind of exactly what you did too, Dylan. I like for students to kind of read the question first, then read the stem, and then pause and think about it. What I tell students is that, as you'll do so many thousands of practice questions that you're bound to see an answer that looks awfully similar to an answer that was right for another question. So I don't personally teach students to look at the answer choices first because it can bias you. And anchoring bias is real. We want to go to what looks familiar. It's funny. I work with students a lot, and they're like, "I knew the answer was wrong, but it was familiar, so I picked it anyway." Right? Like even when they know it's wrong, but that was most familiar, so they picked it. So I like the way that Dylan sort of went through in his question, and you're sort of building your differential and thinking about it as you go before you kind of look at the answer choices is sort of the approach I take.
Yeah, I completely agree.
All right. So some high yield test taking tips. This is, as Dylan and I were talking, I think NBME is as much of a test taking and logic exam as it is, a knowledge exam, right, from your preclinical studies. I started med school in 2020, so I was actually the first class to take step one pass fail. And the questions have sort of changed a little bit, right? The approach the NBME takes with writing the questions has evolved over the last couple of years because the exam is now pass fail. And so it's sometimes difficult to parse apart which details are important, right? That help lead you to the right answer, and which ones may be a distractor, or what I like to call when I work with students, purposefully imperfect, right? The way that NBMEs write questions. So I think it's really important to, first of all, understand the question, right? What I teach students is they want to be diagnosis-oriented test takers. So you want to think about the diagnosis, like Dylan was emphasizing in his question. What's your differential? What's the diagnosis, right? These are usually multi-step questions. So you can't get to, the next step in management or the most likely complication if you don't know the diagnosis, right? So you have to think of the diagnosis first. Right. And then you're highlighting. I'm a real stickler for highlighting because I think it's an amazing tool when used correctly, but it can often be really overwhelming when it's misused, where I see students just highlighting the entire question. Right. So pay attention to the pertinent positives and really what I refer to as what's grossly abnormal, right? Like what's really standing out to you in the question. Okay. And as we practiced, right, with Dylan's question is generate your differential, right? Always be thinking about your differential. And as you're getting new information, when you're reading the question, be moving your diagnoses up and down on your differential, right? Does this make this diagnosis more likely, less likely? Does this make me want to add something to my differential or take something off, right? But always being diagnosis oriented, right? Because that can help you rule in and out certain answer choices, like I said, always cross-referencing your answer choices with those test taking strategies, the patient demographic, the timeline, right? Your pertinent positives. And then, I like this last bullet here because what I tell students, like, it's going to happen. You're gonna, have questions that you experience on NBME. You read it and you're like, I have no idea. Right? Like I feel like the NBME does that on purpose, right? They're testing kind of your logic and reasoning. They put a drug on there. They know you've never heard of that drug before, right? But there's always a way to get to the right answer. And so I think using those test taking strategies and those reasoning skills can help you rule out answers in those situations to give you your best shot at getting to the right answer there. I'm seeing
Yeah.
some comments pop up in the chat here. Um, do you think it's smart to go through each answer choice and try to figure out which disease it correlates to, or would that take too much time? I think, I don't know if you have any thoughts about that off the bat, Dylan, but
Um, so when I am tutoring students, one of the things that I teach them is you should try and find what you think is right. And then
Mhm.
you should also rule out everything else if you can. And when you rule out everything else, you have to have a reason. You can't just be like, oh, it's definitely not PTSD. Okay, well, tell me why is the answer not PTSD? I encourage students to do that when they're starting out on questions that are untimed. Give yourself as much time as you want to develop these test taking skills. Because eventually you're going to get to the point where you can be like, it's not that. And it's kind of subconscious because you're like, I know it's not PTSD because it doesn't fit the timeline of PTSD. But you're not saying that verbatim, but that thought process is happening unconsciously. So in the early stages, when you're developing your test taking skills, I do think you should be doing that. And then on test day, you should do it too, just faster. And if it's slowing you down too much, you may not have the time to do that. But I definitely think you should in the beginning.
Yeah, totally agree. I think that's one of the ways that you know you're ready for the test, right? When you can actually think of the clinical scenario that the NBME is going to test for each answer choice. I mean, you got it, right? Like you know what the answer is. So that might come a little bit later in your preparation, but that's an awesome tool.
Yeah.
Okay. When are you ready to stick for step one? I think we have a poll for this one.
Yes.
Perfect. All right. What do we think? Give it a few seconds here. Give it to maybe 20 seconds. Okay, let's see what we got. All right, I'm seeing B and D. Good. Yeah, I think, we want to make sure that we're like maximizing our chances of passing. You put all this effort into the exam and getting ready and all this time, especially you don't want to delay your clinicals, right, when they start. So I think that, it's amazing if you have D, right? Like at least two tests with 95% likelihood of passing. 80% is great. I mean, 80% is very high. But you want to give yourself a little bit of a margin, right? So like if like passing is I say it's like about 65%, right, correct on your questions. I like for students to be like closer to 70 or like in the 70s because you don't want to be right at passing, on test day doesn't give you a margin if something were to change or maybe you have some nerves, right? So I don't know if you have thoughts about that, Dylan, but that's what I advise.
Yeah, I'm with you. I normally aim for 95% above, and going from 80% likelihood of passing to 95% is not as hard as you all think. Like, it's not going increasing your score by 15% correct. It's by going up maybe like 1 or 2% more. So know that a 95% likelihood of passing is if you start out at a 60 or a 50% likelihood of passing, if that's your diagnostic, getting to 95% is very much within the realm of possibility. So just
Mhm.
know that like 95% is achievable. 80% is okay. The lowest I've ever had someone go in was 92%, but they got that 92% like 6 times. So I'm like, all right, you're a very consistent test taker. You're probably going to be okay. But I almost always try to have people above 95%.
Mhm. Yeah. Yeah, a couple questions make a huge difference.
Yeah.
Okay, so practice exams, like we were saying at the beginning, I think these are absolutely critical. Like I would say, like when I work with students, I build every single NBME practice exam into their schedule if I can, because these are like the gold standard. And I say, you'll use your question banks as your review tool, right? That kind of guides your content review and your learning. But your true assessment tool is your practice exam. And if you're doing these frequently, right, throughout your dedicated period, like maybe every 1 to 2 weeks, depending on how long you have to get ready for the exam, you should be seeing improvement, right? So don't be afraid to adjust your schedule, right? If you're not improving every week, there's something about your study schedule or your study approach that's not working, right? It should be improving, right? These are your assessment tools. So they should be getting better every week if your study schedule is working for you. So that's why I think it's not only are these great in and of themselves, but they sort of help tell you, is what I'm doing even working, right? Am I getting better? Am I improving? You thoughts about that, Dylan?
No, I think that's spot on. I'll normally have people start off, an exam every 1 or 2 weeks, and then as it gets closer to test day, I actually start to ramp that up.
Mhm.
Maybe like 2 a week, 3 a week is probably pushing it. But I agree with everything you said.
Yeah. And the other thing too is like building your testing stamina too,
Yeah.
right? So it's like it's probably been a while since most of you have sat maybe since the MCAT, right? For like a really long all day exam. And that can be really tiring. So practicing getting up in the morning, getting ready, right? Going through the motions can help build that stamina so that it doesn't feel so unnatural on test day.
And I'm gonna butcher your name, Katiuska, but I see your question, and we're gonna actually address that. I also would like to ask how you define dedicated time. So I guess we're gonna get to that in a second about like what dedicated looks like, how we recommend structuring it. I don't know if that may be next. Ah,
Mhm.
it is next. Okay. I'll let you take this one, Rebecca.
Yeah, sure. So these are like just some like sample 6 week calendars that we have, right? So the dedicated study period, what we mean when we say that is usually there's a period of time, maybe like 4 to 8, maybe 10 weeks, right? It depends on your school's curriculum, where they say this is the time that you have to take and pass step one, right? You can take it at any point, during this period, but it's got to be ready, done, passed by this time, and then you go on and move into your clerkship training. And so that's the dedicated period, right? And so it's a period of, I don't know, 4 to 10 weeks for students. And so you kind of want to decide, right? Which is what I think that diagnostic test is so helpful for. How much time do you really need, right? And so like what we said at the beginning was usually 6 to 8 weeks is good for students. If you're an excellent student and you've been really on top of your spaced repetition and your diagnostic test is really encouraging, maybe you take it in 4 weeks and you enjoy the rest of your dedicated period off, right? Before you move on to the next phase of your training. If you need a little bit more time, right, maybe you take it towards the end of that period that they give you. But usually schools give you a period where there's no coursework, nothing to do except get ready and take step one. So when you're putting together this study schedule, right, this calendar for your dedicated period, there are a couple things, right, that we'd want to keep in mind. First, doing questions, as we talked about at the beginning, right? I think questions combined with content review at the same time is nice. Because I think one trap that students can easily fall into is that they do so much content review at the beginning at the expense of practicing those questions. And like I said, the NBME style questions can be quite a bit different than the exam questions you've seen in med school so far. And it's as much of a test taking and logic exam as it is a knowledge exam. So it's important to get those practice questions under your belt. And so I think starting early is good. I think you should also work those practice exams in, right? Like if, again, depends how long you're going to make your schedule, but if you have 6 weeks or 8 weeks, you can plan to do maybe one exam per week. Or if you like Dylan's approach, where you spend a little bit more time up front doing content review and questions, and then do more of the full-length practice exams towards the end. That's also a good approach to have there too. Um, yeah, build in catch-up days. So I like this approach because first, right, if you fall behind, because these are long study days, right? This is a lot of material to master and review. You can make up for that. The second thing that those catch-up days help with, though, is, like I said earlier, really reviewing your progress and assessing is the plan actually working for you, right? Or do you need to change something? And we were talking about active studying earlier. For me, the way that I explain active studying to most people is just it's studying that involves using the most amount of senses as you possibly can. So writing, speaking, reading, hearing, right? That makes studying active. And I think and I'm sorry, I'm forgetting your name, but who brought up the one of the really big pitfalls of Anki, even though I think it's an excellent resource, is that you can just go through the motions, right? It's easy to memorize cards. And so you need to kind of be really disciplined that you're forcing yourself to actually do that recall as opposed to just memorizing information. And so I think on those days, right, having those built-in days where you're constantly reassessing your progress is important to see if you need to make any changes. Right. And then of course, as time allows, I think what Dylan and I were saying at the beginning, taking time for those incorrect questions can be helpful if you have time at the end. But what did you have to add to that, Dylan?
No, I think that's spot on. We will have links to these sample calendars that we have. They're great resources, but they should be used as a template again. Like you should look at them to get an idea of how to structure your schedule and incorporate all the things that Rebecca talked about into them. So, you can kind of see here we have examples of different topics that you can spend some time studying, but you by no means need to follow that. If you're an expert in repro, you don't may not need to do as much repro in week five. You may be just focusing on the things that you're weak on, but agree with everything you've said. Um, you want to talk about this? This is kind of similar to what we talked about, but
Similar, yeah. Like so, for the sake of time, and we're happy to take questions also during the Q&A. But again, we have the 6 week and then also 10 week options, right? So again, the idea is just that these schedules are customizable, and you should create a schedule that really works for you, not only where you're at in terms of learning, but your timeline, right? That works best for you.
This is similar, but kind of what we've talked about. Schedule at least 4 practice exams. The
Mhm.
number that you need is kind of up to you.
Mhm.
Take your baseline and then review your exams. And all of this is incorporated in these calendars that we have.
For sure.
Uh, and then just again, trying to be quick so we have time for questions. Structure it based off of some mixed review, some targeted review, and then again, focus on those weaker areas up front. And then also near the end, so they're kind of fresh in your brain come test
Mhm.
day. Um, Rebecca, if you want to summarize this one too.
Yeah, I mean, I think and the only thing I might add too is at the beginning of your dedicated period, schedule your exam. I think that was on
Yeah.
one of the one of the slides. It
Yeah.
gives you something like when you have an actual date on the calendar, you're like, okay, I gotta be ready, I gotta take this seriously. So definitely schedule your exam. You can move it if you absolutely need to, but I think that it's better to have it set in stone, so that you can plan around
Right.
that. And then, like we were saying before, right? Do your questions when you have the most mental energy, right? So if that's early in the morning, that's great. If it's midday, later in the day, usually I tell students, if you need to mix it up throughout the day, that's fine. That's understandable, right? Because it can get monotonous. But as long as you're getting through the material and you're seeing the progress over time, that's really what I care about when I'm working with students.
This is just some, I guess, like last minute tips. We're kind of gonna breeze through, but other things, like Anki's a great option for spaced repetition. There's lots of mnemonics. You can find these all online. There's a bunch, and a great resource is actually First Aid for mnemonics. They have a ton. They're going to help you remember a lot of these more challenging topics. So we'll leave this up. I'm going to have that slide up, and we're going to dive into the Q&A. Um, we want you guys either you can speak up, you can type them in the chat. We'll answer them. Rebecca and I are happy to stay as long as we need you to answer your questions. We would love for you all to stick around, but we know that it's almost 9 o'clock and we know you have things to do. So if you need to dip out, that's completely okay. But first, we really appreciate you all being here. Um, I think I'll leave this up as well, but this has all of our info. So if you want to reach out to us, if you want to speak with us, set up a consultation, check out our webinars page where we have a lot of other webinars. Um, we have all of this online. And again, Rebecca and I, we tutor. We have a lot of other fantastic tutors at our company who are willing to work with you all. And you can just email us at that email address if you have specific questions. So I'll leave this up for now, but why don't we dive into some of the questions? We already have two right now, so I'll read Trisha's first. What's the ideal time per question? I should aim for when both reviewing right and wrong answers without getting bogged down in the details. So I'll give that one to you first, Rebecca.
Yeah, I think eventually it will have to be about 60 to 90 seconds per question, right? Is kind of what it boils down to. But especially at the beginning, when you're getting used to these questions, I tell students don't focus too much on the time. As the review comes, the material comes, you get a little bit better and more comfortable with the NBME style of questions. Timing usually comes with that a little bit later on. So I'd focus at the beginning on content review and sort of building towards that 60 to 90-second time limit per question.
Yeah, I completely agree with that. Um, the next question that we got is how much score progress do you think can be made in 1 to 2 weeks if practice exam scores are low, 78% chance of passing, or would you recommend pushing the test date back? Truthfully, it's hard for us to answer that without knowing who you are as a holistic individual. Um, Here's a good anecdote. I worked with a student. He went to medical school in India, and he'd been studying for step one for a year. And this was back when it was scored. He wasn't getting the scores that he wanted, and he was really like banging his head against the wall. And I met with him, and I realized that this is one of the most brilliant students I've ever met. But he had no idea how to answer a question. He like
Mhm.
knew the material so well, but when he went to actually apply it, he couldn't do it. And within a month, he was scoring. He went up like 30 points. So that's definitely not everyone though. There are some people who are like, you just don't know enough content. And like that takes time. So it's hard for me to advise you without knowing who you are. It's definitely possible for some students, but for other students, it's not as likely, and you may need to push it back. Rebecca, I'll hand you Rosie's question, which is which MBME would you recommend for the baseline and other three tests? if you have any thoughts about specific tests or not.
Yeah, I mean, not really. I kind of just have students do it from oldest to newest, right? The newest NBMEs have newer questions, right? That students haven't seen before. So for the first test you're taking, maybe make it one of the older ones, right? Like 27, 26, 28, and then, progress towards those newer ones. But again, I think all NBME questions are valuable. If you think about it, if you do all the practice exams, it's almost like another question bank that you're getting through, which is really, really valuable. So that's just kind of what I use, but I don't know if you have a different approach, Dylan.
No, I agree. I think again, I feel so old talking about when I took this test, but back when I took this test, the NBME did not make as many new tests as they do now. It was like, here are these tests, and they've been there for 5 years and they're not being changed. So back in that day, we knew these were the best tests. There are new tests that come out pretty frequently now, and it's really hard for us as a company and individual tutors to accumulate enough data to be like, yes, these are the best tests. There's a lot of
Mhm.
anecdotal stuff that you'll see online, and some tests definitely are harder than others, but that's
Mhm.
why we recommend you need to show consistency. So 95% above on two tests, regardless of what test they are, is a pretty good prognostic indicator you're going to do well. I just would not start out with a UWorld or AMBOSS test. I would start out with an NBME. The UWorld and AMBOSS tests are fantastic for practice, but the score they give you and the likelihood of you passing tends to be pretty incorrect. Um, this is my hypothesis. I don't have any financial stake in either of those companies. But if I was designing a testing company, I would want you to look like you're not going to pass. So you would have to keep using my resource, make you the best test taker you can be. So then you definitely pass on test day. So my personal experience has been like, for example, UWorld will tend to underestimate people's ability on test day, which is good. I'd rather it do that than overestimate. But that's
Yeah.
why I think the MBMEs are better in terms of that baseline. And then as when you really want to assess, am I ready? Use the MBMEs. I would not use UWorld or Amboss. I kind of tuck UWorld and Amboss in the middle as like a, hey, I just want to work on my stamina, make sure I'm answering questions right, but I don't really care about my score just yet.
Yeah, that's a really good point.
Other questions? Anything else that you all have? All right. Well, if there are any other questions, feel free to put them in the chat. Again, our info's listed up here. So please feel free to reach out to us. Take advantage of the resources that we have on our website. They're truthfully very good. Rebecca and I have contributed to a lot of them. Not to toot our own horns, but we think they're very helpful. And again, please, if you need anything, let us know. On prior webinars that I've hosted, I've had students reach out to us to set up sessions, and we'd love to do that with any of you or connect you with other tutors that may be better suited for you. Okay.
Mhm.
And thank you
Great.
guys all for coming out tonight. We really appreciate it. And best of luck studying.
Thank you. Thanks for coming, everyone.